The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, very interesting topic. Millions of Americans are afraid of the dentist. And my first guest, Dr. Mellert, says, don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have an expert on this topic dealing with highly anxious patients. Dr. Mellert, welcome to the program.
Thank you, Randy.
All right.
Pleasure to be here.
Very interesting. I told you, our program airs throughout the U.S., and I talk to dentists all the time. But you like, and that's an understatement, you like dealing with these people that are very afraid of the dentist and then turning it all around.
I take just tremendous satisfaction and pride in my role of being able to turn them around.
Okay.
And it's really fun.
Okay, good. Now, before we get into today's topic, tell us a little bit about your practice. I mean, what are the procedures you do? I mean, you do kind of everything. You call yourself a decathlete, or at least on the telephone. What does that mean?
Really what it means to me is that in our office, we have a very comprehensive approach. I have an associate that does cosmetic fillings primarily, and I do periodontal surgery, crowns and bridges. I place dental implants, and really get involved in just reconstructing the dental disease that's present.
You said you like reconstruction. Like people
I do.
That their mouths are in a mess.
I really
right?
do, yes. We have people whose mouths are really in a mess. They haven't seen a dentist sometimes for 20 or 25 years, believe it or not, and they come into our office. And then we need to do whatever it takes to just get them back on track and start reconstructing what's been damaged.
Now, you went to USC.
Yeah.
As a USC dentist. Father was a dentist. Grandfather was a dentist. You guys
Right.
all went to USC.
Yeah.
Did you always know you wanted to be a dentist?
I did. My grandfather graduated in 1925 and practiced
right?
for 54 years in LA. My dad graduated in 1954 and practiced pediatric dentistry for 52 years. And I graduated in 82, and I'm at 29 years.
Not a lot of USC dentists that can say that, right? Probably, I mean.
Very few number, I think.
Now, you always wanted to be a dentist?
I did. I loved.
Did you work in their offices?
I did. I worked in my dad's office. I sat around and heard my grandfather and dad talk a lot. They really loved what they did. I saw that they were respected by their patients and friends. And then when I learned even more of what they did, I just fell in love with the procedures and the ability to help people in their lives.
Now, today's topic, and if you're just tuning in, we're talking about, how not to let your fear of the dentist keep you from getting the smile you always wanted. You like, and I talk to dentists behind the scenes, they don't like this highly anxious patient. Why do you like it? I mean, this is who you attract, as a matter of fact.
I do attract a pretty significant number of patients that are incredibly anxious. And I will
define. Is it really that big of a problem, by the way?
It's huge. I would define that by people that have stayed away from the dentist for many, many, many years, knowing full well they have a significant problem. Either they wake up with loose teeth and they know it, bleeding gums, terrible breath, and or dental pain that they're somehow able to put off for a long, long time.
Just afraid of the dentist.
Completely.
I talked to your office manager. I hear that you've actually had to go to the parking lot.
I'm happy to do that.
To get people out of the car.
No, not even to get people out of the car, to meet them. I want them to see that I'm a normal guy. I'm on their side, and that's really what we're trying to do. We're trying to build a trust relationship so that they obviously can just verbalize their fears, and I'm not going to judge them for that. I'm going to understand them and then kind of tailor what we do to reduce their anxiety. And it works.
These patients that are afraid of the dentist, do they think they're alone? I mean, do they think that
they think yes, they think they are the worst patient I've ever seen in terms of fear. And I have
say that all the time?
I hear that every time. I'll even beat them to it. I'll say to them, when they're just shaking like a leaf or even crying in one of our rooms with anxiety.
Crying?
Absolutely, yes.
And I'm smiling, by the way, not to
because you can't believe it.
To believe a little bit.
It's absolutely true.
Yeah, in the green room, you're saying that in the office or in your waiting room, they're crying.
Yeah. And back to the parking lot thing, sometimes their anxiety is so bad, I'm just happy to just shake their hand through the window and maybe they'll make an appointment. They're petrified.
Okay, now, patient comes in. They're scared to death almost. And you say some interesting things to them right off the bat.
Yeah, I will tell them I'll say I have a few statements that I don't think you've ever heard another doctor tell you in your life. And usually they're shocked to hear that. And I'll say, first of all, I have my set of fears in life. I stepped on a beehive when I was 12, so to this day, if a bee were to get in my car, somehow windows are down, I have to pull over and roll the windows down. I feel a little embarrassed doing that. So what if I get stung? I'm not allergic, but they relate to me in that I'm honest enough to share my own fears. When I validate their fears and say this fear is real, and there's something behind the fear, and you kind of can think about that on your own, but I want to know, what is it that's so fearful when you think about having your dental treatment done? And
what do they say?
Many times they'll give me a long list, and I'll write down the list. Fear of the needle, fear of the smell, fear of the sound, fear that you're going to make a mistake, fear of financial expenses, fear of shame, that they're feeling embarrassed to show me their dental problem. So when I let them know, I've heard this hundreds and hundreds of times. We've been through this, and we can actually work with you and reduce your fear.
You also tell them, by the way, that they can leave at any time.
I do.
That's not offensive to them? I mean, what do you
It's
say?
No, they are so relieved for me to not judge them and to say to them, here's the deal. You saw the door in, you can leave at any time during your treatment. There's nothing that we're going to start for you that you can't raise your hand and say, hey, my anxiety is such, I can't do this.
Is that right? So you like that? Are you, because you said that there's a great amount of shame. Would you say there's 500,000 people in the whole LA area that don't smile, they look mad, it's their fear of the dentist that's keeping them from doing anything?
Well, 3/4 of the population has some degree of gum disease. And that means bleeding gums, bad breath, moving teeth that are shifting, and these patients realize that. And they don't know what to do about it. It's kind of a very slow progressing disease, so they've had it for years and they just continue to put it off. Okay. So something eventually, a problem gets to the point that they have to do something about it. Now, who do they call? Maybe they get a referral from someone that I've treated, or they go to another dentist that is going to maybe use some of the techniques that I'm talking about today. But really what we're doing is validating their fear, and then I'm saying to them, what is it that bugs you the most? And if they say, oh, it's the shot, then I say, I will give you a dental injection that you're not going to feel.
Really?
Yeah, really. And they say really. And yes, and it's incumbent upon me to actually deliver and take my time and use the smallest needle we can and the smallest amount of local anesthetic to begin with. And once they see that I'm really going to do what I'm promising to do, their trust goes up. And it just is a matter of time until that trust goes just to the level that their anxiety starts to reduce. What I'll do is just take my time using topical anesthetic, get them numb, and allow at least 5 or 10 minutes or more if I need to. Or actually, I'll say, let me kind of loosen the tooth up a little bit. And the patient say, okay. And meanwhile, the patient's kind of like bracing. This is like the first visit, particularly, first or second. Okay. They're bracing the chair and all this, and they're sometimes, highly, highly anxious. And then I'll say, oh, are you ready for me to get started? And they'll say, oh, yeah, I'm ready. And then I'll say, well, the tooth is already out. And usually they laugh. They're just so relieved. They can't believe it. But that type of thing happens all the time, even with other procedures. A lot of people are looking for an excuse to leave. And so what we do is we just try to take those excuses away. And they all of a sudden realize they just went through a procedure and it was not a big deal. It didn't hurt. It was easy to do. And I let them know what we were going to do in advance. And they are so excited when they're done that they accomplished this. So the next visit, when they come back and I say, well, what was that like when you put your hand on the door to my office to come in? They'll say, oh, my anxiety was greatly reduced. I didn't have the rapid heartbeat. And I'm going, that's what it's all about.
You say it should be like getting a haircut. What do you mean by that?
That's the goal. Anxiety-wise, I think when the average person gets their haircut or a woman gets her hair done, I don't think she has anxiety when she walks in. That's what my target is. When I tell patients that, they laugh. Oh, that's impossible. That'll never happen. But often after like 6 to 7 visits, it happens.
This is interesting because I've never met a dentist that actually likes, they say, oh my goodness, these dental phobes, I don't want to see them. And you like them.
I do.
You said, you told me, you said, I'm a skier. And the feeling I get, you told me about someplace in Colorado.
Oh, I just got back from a ski trip in Colorado.
Tell that story.
One of my favorite things to do in life is ski. And the fun and exhilaration I feel when I ski, I notice and I almost sound apologetic to say this, but I feel that same fun and feeling of exhilaration when I'm involved in turning around an anxious patient.
Really? Like when they say,
to me, it would be the feeling of like climbing Mount Everest for a patient. I mean, the impossible.
Really?
For them, it's achieving the impossible, and to even have a small role in that for me is extremely satisfying.
Now, by the way, when you're in the other room and they're telling you, Doc, this person is so afraid. I mean, does that make you like, oh, I can't wait to get in the room?
Yeah.
Really?
Yeah. Let's go.
It's like a better
Let's go. Yeah. How fast can I get in there? Let's go. Let's reduce that fear. I don't like to see people that are bound up in fear. Let's reduce it.
You told me in the green room, you said, I don't want to do everything in one day, especially with these highly anxious patients.
No way. I intentionally don't. Because
isn't that what everybody wants?
Well, it's exactly what they want, but it's exactly the wrong thing. Because so we solve their problem today. 2 years, 3 years, 4 years from now, they're going to have a different problem. Their anxiety has not been dealt with. So I want to intentionally slow it down.
Oh, really? Okay.
Way down. Right. So we can get some really great positive experiences. Their anxiety is reduced, and then we can kind of do it at their pace. So if for financial reasons or time reasons they want to go rather slowly in the beginning, hey, that's fine. I have no vested interest to go fast. I want to do it at their pace, and that's kind of my basic theme is I let the patient be in control of their treatment. And that's what the statement I make they've never heard from another doctor. You're my boss. You are in control of everything that goes on here. It's obvious, but to actually verbalize that to the patient is really disarming, and I think empowers them.
Now, when people, you say they're ashamed, they go to your office. Okay, they're afraid of the dentist. You lower their fears. You tell them about your own anxieties and phobias that you have. I mean, what are the frequently asked questions? I mean, what do I know? Is it
they say, I am so embarrassed. Please don't judge me because it's been 10 years. And I'll just say, you're here. You're here today. That's all I care about. Let's talk about today. Well, I'm so ashamed. And women will cover their mouths like this. And I'll say, come on, we're here for you.
Okay.
And then I present what their options are and try to break it up step by step. And then we just start making positive steps. And often I'll say, look, I don't want to have dental treatment that I don't, it's not something that any of us want to, have unless we can do something else. I mean, that's normal to avoid what could be unpleasant. But you still have a problem. You need someone to fix it, and you need someone to fix it in a simple and painless way as possible. And I'm happy to help you.
So you do this sequential approach.
Mm-hmm.
Okay, so somebody comes in. Who's your typical patient that comes in? They haven't seen a dentist in 3, 5, 10, 20 years.
Mm-hmm.
Definitely afraid of the dentist.
Mm-hmm.
I mean, what do you start with? You start with whitening, or you start with cleaning up the gum disease? I mean, what's the typical plan in your mind?
Well, it starts with a lot of talking. And we have to talk about, what's their story? How'd they get to this place? And what's happened in the past? And
you're like a psychiatrist, a dental psychiatrist.
I'm like a psychiatrist for a very brief period of time. It doesn't take long to break through and find out what it is. And then I'll say, tell me about your history. What's happened with previous medical and dental treatment? Generally, they'll give me some direction to go, and then I'll say, well, that's not going to happen in this office. We're going to respect you. If you tell me something hurts, I'm going to stop and do whatever it takes. I've heard a million stories, and if people will verbalize what's going on, then obviously I can do something about it.
One of the things we were talking, and I was talking to your office manager, and you get a lot of these patients. And I thought, how the heck do you get patients that are afraid of the dentist? It's because I guess they tell each other. I mean, This is probably the ideal referral patient because they leave bragging about you to all their friends.
Well, they're so happy that they conquered this fear.
I mean, this is like your specialty in a way. The person that's afraid of the dentist.
Yeah.
Is it?
Well, it's one of my passions in life. It is so fulfilling and so much fun to turn someone around.
Okay, good. What is full mouth reconstruction? When you say, I like reconstruction, what does that mean?
Well, all we're doing is replacing diseased teeth or damaged teeth or teeth that have been lost over time.
Okay.
How we replace them, we could use dental implants, we could use complete bridges, we could use removable partial dentures, we could use complete dentures. There's a lot of options that are available to, quote, reconstruct or give someone back what they had at one time. So I think that's what I mean
so this
when I
philosophy
say
that you call yourself a dental decathlete, that means that normally what would be done with a few specialists, or at least a couple of specialists, you do it all under one roof.
I still use specialists, but I think I do more of the specialty procedures than probably the average general dentist does.
Like periodontal surgery.
Yeah, I love periodontal.
So you've had special training in periodontal surgery.
I had more than the average training in dental school in periodontal surgery, but I started doing it in day one, 1982, and I love it. And I've taken so many courses over the years, and I've just done thousands and thousands of procedures by now.
Now, especially for the person afraid of the dentist, to go to the general dentist and then have to go to another dentist, get familiar with him or her or whatever, they probably never come back.
That's what happens.
Really?
Yeah. That's one of the reasons I had, probably because of my grandfather and father's input in my life, I knew that if I were to take these patients that haven't been to someone in 20 years...
We should mention if somebody just tunes in. Your father graduated USC, a great-grandfather in 1928 or something like
Grandfather. Graduated in 25.
So everybody was a dentist. You worked probably 10 years old in a dental office.
Yeah.
This is all you do.
Yeah.
So you learned from your father, your grandfather. That's what you were.
Well, if someone hasn't seen a dentist for 20 years, there's obviously we've talked about why. There's a lot of anxiety behind that. If now I refer them to an oral surgeon for extraction of a few teeth, a periodontist for an evaluation and potential full mouth gum surgery, a root canal specialist for root canals on different teeth. Most of these patients will get frustrated and just kind of throw up their hands and end up with dentures. They'll say, it's not worth the hassle, it's not worth the expense, I'm having to go to 3 to 4 different offices, and I give up.
That's what makes you a decathlete.
Well, I decided day one...
I like that. You said, I don't know if patients are going to understand what I mean by that. Well, it's like a decathlon person can do, they're good in every sport.
Multiple events, right.
Okay.
So,
that's you.
Right. So can I deliver periodontal surgery for this patient? Yeah, if it's required. Can I place dental implants if necessary in certain circumstances? Yes. Now, do I still refer out dental implants? Yes. Do I refer out periodontal surgery? I do. And do I refer out root canals? Many times.
But most of the time, you can handle it.
Probably 50% to 80% of the periodontal surgery or root canals or dental implants, I do. And this group of people really, really appreciates that because they don't want to start up a new relationship with a new office.
You have some technology in your in your office. It also eliminates them having to go elsewhere.
We have a CAT scan within the office that gives us, 3-dimensional view of what's going on within the mouth and the supporting structures. And it's just a great tool to have. And we can get the results within about 20 minutes, and it's very inexpensive to the patient. And I think it sets us apart. There are very few offices that have that machine.
Now, by the way, your consultations are free?
Yeah.
I mean, if somebody's watching this, they want to go in.
Yes. It's a quick meeting. Let's talk. Tell me about your anxious.
You may or may not go drag them out of the car, right? Go out there.
Never dragged anybody out of the car, but I'll certainly.
You've gone to the parking lot,
right?
Because the spouse comes in or the friend says,
yeah.
Could you meet my?
Well, the spouse has realized there's a tremendous bad breath issue that's been driving the spouse crazy for a long time, and through prodding and encouraging and all, the patient will say, "I'm so nervous. No, I can't do it." And then the spouse will say, well, if you could just meet Dr. Mellert, maybe your anxiety will go down. And then I'll say to the spouse, I'll meet him. What do I need to do? Go out in the parking lot? And many times the wife will go, okay, could we? And I say, okay, fine, it'll just take a minute. They call up, we're in the parking lot now. I go out and meet Mr. Jones, and he sees that I'm a normal guy, I'm friendly, and I'm here to help him. So, yeah, it's happening.
Like a reality show.
It could be.
The dentist that goes in, because it's hard to believe that there's so many people out there, tens of thousands of people that have this huge anxiety of the dentist.
Yeah.
But it turns around, you say.
It turns around.
You also say some people even drive around the block, or they arrive and then they leave.
Yeah, common.
Takes a few times. Really?
Common. We fully know that. And by the way, it's really important to say, my staff is fully on board with my technique. I mean, the goal of my staff is to accommodate the patient.
There was an office manager, or your office manager was telling me, she said, yeah, there was a woman that she was very harsh with me. She goes, now I really like her. Like
right.
they become friends.
We see through that harsh behavior. We know that's a cover. We know that's anxiety,
that's
actually.
Interesting.
Yeah.
Yeah, your office manager said, when we meet people for the first time, we know that this isn't going to be the way they're going to be. And I'm paraphrasing slightly, but she said, I always wonder what they're really going to be like.
Right. Right.
And they become this nice, wonderful people.
We see that all the time.
How important is a smile?
Well,
somebody
huge.
watching this, they're afraid of the dentist, they don't smile, they've got bad breath, bleeding gums, etc. Tell them why they should do something about their smile in this economy.
If we feel reluctant about the way our teeth look, we're not going to smile. And so it's important to smile, and if your teeth show your teeth. And we can be involved in giving you a great smile. But the confidence that patients have, I think, is very, very important, whether it be their breath or, improve the looks of their smile.
Is breath one of those things? And by the way, when should somebody do something about it? Okay, so their breath, it's when your gums bleed, when you floss, that's number one. What else?
They have a terrible taste in their mouth often. They know they have bad breath. They've been told by other people. And so they come in, we take x-rays and do an exam.
Is that an easy one for you to fix, by the way, bad breath?
It can be. Unless there's a non-dental source of the bad breath, and if that's what we determine, then we'll refer to a physician to track that down.
Do you think you're making people healthier?
No, I know we are. Absolutely. People have extremely bleeding gums many times. That can't be good for the person. We know. American Heart Association will go along with that as well.
Are there people, by the way, that you see act differently? Like on the 6-month follow-up, the 12-month follow-up?
They are so proud of themselves that they've faced this. We've helped them face this fear. They've moved past the fear. It's just no longer a part of there's just no longer a fear in their life.
Okay, good. And we're going to take a quick break. What do you want somebody to know about you? They're really afraid of the dentist.
Well, I would just hope you'd give, whether it's me or another dental office, just be upfront with your fears. What's behind it? Talk about it. And hopefully your dentist is going to be just willing to hear what you have to say in a non-judgmental manner. And then once that happens, proceed with dental treatment. Because it's really, today, it can be done painlessly and very easily for the patient.
And it's a lot less expensive, obviously, if you do it early.
Right.
Catch things early.
Right. That's the goal.
Okay.
Very
good.
early.
Quick break. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My guest here, Dr. Mellert. He's well known all over LA. People travel great distances because he specializes in dealing with the patient that's afraid of the dentist, whether it's a CEO of a company or just regular people, and no job is too big for you in most cases. Is that right? You do periodontal surgery and everything under one roof.
Many times.
Okay,
as I mentioned, I do refer out some, but.
All right. I'm Randy Alvarez. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic: dentistry for the patient that has a phobia about going to the dentist. With us, we have Dr. Mellert. In fact, this is what this kind of patient you like to see, is a patient afraid of the dentist. And, of all different classes, from CEOs of the company. I mean, is it more women than men? I mean, who's more afraid of the dentist?
No, I couldn't say more women than men. I think it's even, from my experience.
So what have you done? Okay, so we've talked about how you meet with the patient, explain that this is very common. Okay, you get rapport with them, you let them know they're in control of the treatment. But what do? I mean, you have TVs and things like that, headphones?
Well, first of all, it starts in the waiting room. We want to make sure we get them in promptly. We do not want to have any patient wait a long time in the waiting room at all,
okay, because
that just adds to their anxiety. We bring them in right away, we hear what their initial complaint is, and we start on the path of addressing that initial complaint. And they see that I'm right there for them, and I'm interested. I want to know what it is. And then I'll talk about what's kind of the missing link or what's a part of their anxiety that I really need to know about. And if they say, I can't even describe, I can't even put it into words, I'll volunteer things that might be part of it. And then as I mention different things, the sound of the drill, whatever, they'll go, yep, that's it. And so, it's all of the above. And then when they say, yes, it is absolutely all of the above, then my answer is, let me just tell you this. Part of fear is a lack of control. So I am going to give you all the control I possibly can. And that also means you are my boss. Well, that is a very disarming statement for that patient to hear. They're shocked that I would say that. And then
they're allowed to leave.
And then I will say, if your anxiety gets to the point you need to leave, tell me. And I won't pass judgment on you. Just go ahead and leave. There's the door. You have complete freedom because you are our boss.
And they can listen to music.
They can listen to headphones. There are TV monitors. I sometimes hum when I'm working.
Sometimes, or just about every time?
Well, I think every time when I'm really into it, I end up humming. And I don't really mean to, or I hum along with whatever music we have playing. But I find when that's happening, I'm totally in the zone. I mean, it's a great feeling. It reminds me of whatever you're doing, or maybe anything you're passionate about.
Sure.
When you're really, really into it, you know, there's no time kind of stands still, and you just are enjoying what you're doing. And that's what I find happens.
When it's all said and done, what's a typical thing that they will say to you?
They'll just say, I never, ever thought this was possible.
Really?
Yeah.
Okay, good. So
and that's just so satisfying.
You see beautiful smiles all the time?
Yeah. That's the goal.
Transformations in their life?
Right. That's the goal.
That's the goal. Well, I want to thank you for coming on the show. Very interesting.
Thank you.
Now, if somebody wants to make an appointment, they could go to your website, find out more there. They could go to Dr. Ogle.
Right.
On and hear, I guess there's hundreds of people that are saying great things about you, and very interesting. Very pleasure meeting you.
Thank you.
Good stuff. You've been watching the Wellness Hour, leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again, go online at wellnesshour.com. Just put in Dr. Mellert. You see the whole thing. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.